Right, so we have been we launched off on Monday for Glaucoma Week, a series produced by Janesta Agard, where we've had different people come in and speak about glaucoma. And yesterday we had Niall Farnon, who was here, and he's back with us again today to continue speaking. Niall, of course, is an optometrist and a lecturer at the University of the West Indies. Welcome back.
Thank you, Lisa. Thanks for having us.
Yesterday we were talking about the symptoms and causes of glaucoma. Just give us a little summary for those who might have missed it, and then we launch straight into treatment.
So one of the dangers of glaucoma, there is no symptoms until it's quite advanced. So it's estimated 50% of people who have glaucoma do not know they have glaucoma till around 3 to 5 years after it actually started.
Right.
And that is the big danger. The viewers at home may think nothing's wrong with their eyes. I don't need to get my eyes tested. And in fact, they could be having glaucoma.
Yes.
And the risk factors, one was age, the other was a family history, heritage, Afro-Caribbean, and even people with diabetes. But they're risk factors. Just because you don't have those, it doesn't mean you cannot get glaucoma.
There was a big question, and I want to ask you, I didn't ask it yesterday, but if you're wearing glasses already or spectacles, you go to the optician, optometrist, and you get it tested maybe once a year, maybe once every 2 years.
Yes.
But if you have, in your mind, 20/20 vision, you're not wearing any glasses whatsoever, is it possible to go from that to glaucoma in 3 to 5 years?
Yes, that is the danger again. That's the thing. As I said, it's the side vision that gets affected. So people can think they can see down the road, I don't need to get my eyes tested. And remember, no pain, no immediate symptoms, and that's the problem. People just don't think of getting their eyes tested.
So okay, so even if you have perfect vision, or what some people call 20/20 vision, you should still, just as a matter of course, test.
Particularly if you're in those risk factors. We're all going to go over 40, we're all going to be over 60 someday.
Yeah.
And then, as I said, a family history, because it's quite prevalent here, more than likely somebody in your family had glaucoma or has glaucoma.
Okay.
And then, of course, the heritage of Afro-Caribbean, and then a lot of people have diabetes. So.
Well, I didn't drive that point home yesterday because, you know, you're thinking glaucoma, you're thinking anything to do with your eyes. You definitely have to be wearing glasses already. You know, I'm not wearing glasses, so I'm fine. But I think that's a very important point to drive home. Test regardless.
That's it.
All right, so once you're tested, the positive, what's the treatment?
So if it's picked up on time, which again is the whole idea, get it picked up on time, it can be stop the progression by using drops. Now, one of the problems, again, it cannot be cured. And so if it's picked up on time, in Trinidad, you have to go to the ophthalmologist. The ophthalmologist will give you drops, but only if it's picked up on time.
Right.
Now, sometimes patients, the ophthalmologist may give you a sample of drops, and patients think, oh, just put the drops in and that's it. Now, this is a lifelong disease, so you're on drops for the rest of your life.
And these are daily drops?
Yes, so nowadays we have much better drops, so it could be once a day. But again, if it's picked up too late, you could be using 2 drops or even 3 drops. And that's one of the issues. Again, get it picked up on time, and it can be easily managed with drops. Now, one of the disadvantages in some patients' eyes, the drops sting when you put them in, and they can make your eyes a little bit red. But I mean, that's a little bit of a trade-off from losing your vision. I mean, we only have one pair of eyes and can't have an eye transplant. So, you know, patients get a little bit vexed having to put the drops in the eyes, but if that's going to prevent the vision from getting worse, I mean, that's what we should all do.
Is there a case where surgery is required at all?
Yes, so if it's picked up too late or people don't use the drops as directed, then unfortunately surgery is one of those things.
And what is the surgery for?
To help the optic nerve stop being damaged.
Right.
So, you know, I just came back from a conference. One of the big things is that glaucoma is always talked about being pressure, the pressure being too high in the eye. And a lot of patients can get obsessed about just the pressure, but it's not the pressure, it's the damage in the back of the eye that's the cause of it. You could have normal pressures, as we would say, and you'll still have glaucoma. And so we're trying to move away from this whole thing of high pressures, and actually just anybody at any stage, the pressure may be too high for that eye, and that can cause glaucoma.
Yeah.
I mean, one of the things, it's just all about the drops. Don't forget to take the drops. Sometimes, if you have to do it twice a day, a patient forgets, and then he puts 2 times at night. That's a waste of time.
Yeah.
And then if people are on 2 drops, they put 1 drop in, and then immediately put the next drop in. Again, that's a waste of time. Patients should wait 5 minutes between the drops. And yes, as I said, they sting and they make your eyes a bit red. And the other thing that patients stop taking drops is because when they use the drops, they expect the vision to come back. And that's the danger. Once the vision is gone, the drops aren't going to help you. Surgery isn't going to help you. Once that part of the optic nerve is damaged, there's nothing more that can be
So
done.
what is the purpose of the drops or the surgery if it doesn't help you?
To stop it from getting worse.
Okay, so your vision would remain at that
That's
particular
it.
point
So
wherever
it's like
it
putting a
reaches.
pause on your vision by using the drops correctly, or if needs be the surgery, and that should stop it from getting worse.
And there are no corrective lenses or?
It's all happening in the eye, so
Okay.
anything outside the eye, contact lenses, spectacle lenses, won't make a difference that
Right,
way.
so you just have to learn to live with that vision at that time.
That's it. And again, remember, by the time the patient realizes there's a problem, we've lost 3 years already, 5 years.
So we're talking treatment today. So if you're on treatment, remember to drop the drop in your eye.
That's
I
it.
like that campaign. Drop the drop in your eye. All right, Niall, Farnon, thank you so much for
Thank you,
coming.
Lisa.
And
Thank
tomorrow
you
we
for having me.
continue the series tomorrow and Friday.
That's it.
And it's been a pleasure having you on the program.
Thank you, Lisa.
We're
so
going to
much.
take in a few messages because we do have a packed program as usual here on the Now Morning Show. Do stay with us.